This outbreak is unusual for Texas. We haven't had this sort of an outbreak since the early 1990s.
That's Texas Health Commissioner Dr. Jennifer Shuford speaking about the outbreak sweeping our state. The number of people with measles in Texas has climbed to 146, with one unvaccinated school-aged child passing away. Here in Bexar County, San Antonio Metro Health confirms there have been no reported cases since the outbreak started.
News 4 San Antonio Stephanie Esquivel attending a briefing today and explains we are not, though, in the clear for the measles exposure, at least not just yet.
The symptom appearance can happen anywhere from 7 to 14 days to up to 21 days. So folks might be incubating during that period, and if somebody were to come down with the disease, the latest day that they can come down is March 8th.
Metro Health's Dr. Anita Kurian says thousands of people in the area could have been exposed to measles on February 14th when a visitor in town tested positive for measles. People who were exposed to the virus could still show symptoms over the next week. Dr. Kurian says it's not too late to get the measles vaccine.
Get vaccinated if you are not vaccinated. Get vaccinated within 72 hours of exposure, because you can then prevent from coming down with the disease.
So far, Dr. Kurian says there are no confirmed measles cases in Bexar County. There has been one reported case of rubella or German measles at a Cibolo charter school campus, but Dr. Kurian says they're not related.
It's caused by a totally different virus.
Dr. Kurian says several departments have met with the school and provided guidance on what needs to be done to prevent a German measles outbreak.
The signs and symptoms for German measles or rubella is pretty similar to measles, but the difference is the symptoms are pretty mild compared to measles, and the contagiousness is pretty much lower than measles.
Over 94% of students K through 12 in Bexar County are already vaccinated. According to Dr. Kurian, Metro Health is focusing on tracking any possible exposures, keeping people informed of those possible exposures, and getting people vaccinated.
Our primary concern is the unvaccinated individuals. So 90% of the unvaccinated individuals who come in contact with the case can get the disease.
Stephanie Esquivel, News 4 San Antonio.
Thank you for watching. Please like and subscribe to get all the latest news right here.